Hey everyone, welcome back. It's Dr. Jana, and I'm going to do a different kind of podcast today, and it is going to be centered solely around caring for our kids and my favorite products, my medicine cabinet essentials, because this year, as you know, cold and flu season has been another beast of a year, and I keep getting asked the same questions over and over. So I thought I would go ahead and turn this into a podcast and a YouTube video blog so that you could see what I'm doing. So if you are hearing this by way of podcast, you can find this exact same recording, but with the visuals of the products I'm going to share on my YouTube channel, which is Dr. Jana Joshua Graham, DC. So all of the products, as we get started, you're going to want to, first of all, grab pen and paper. So I would start doing that now, or pause this video or podcast and go grab that before I start mentioning the names of specific products and instructions so that you can be prepared. But all of the products I'm going to mention can be found on my online store on my website, drjana.com. That's drjana.com, and it will be in the description below. You simply click on the store tab on my website, and these particular products are all going to come from my Nature Sunshine online store, and a few are Young Living essential oils, but this is not an essential oils podcast. Don't worry, it's going to involve a lot of other awesome comprehensive products as well. But if you don't have a Young Living account and you hear something that I mentioned that seems applicable to you, that can also be accessed through the store tab on drjana.com. So I'm going to be giving you guys exact names and how to administer these products and what they can all be used for. Every single thing that I'm going to mention has universal application, so they should never go to waste, and they can be used for other family members. You don't have to be an infant or a young child to use them. But these are the things that I have used to address even the worst of colds and flus that have come through our house, as well as very severe RSV in my youngest, Justice, a year ago when she lost an entire clothing size. But we did avoid going to the ER or using any chemical medications or antibiotics, and I got her through it, and it was quite amazing. So in addition to all of these things, another resource that you may want to look up and utilize, maybe you've heard of it, maybe you haven't, is wet sock therapy. You can do a quick search. I plan to make this into a blog soon. I just haven't done a lot of writing and recording for the last 6 years since I had kids, but I know that this one is overdue. So stay tuned for that. But just hear me that wet sock therapy is extremely effective and applicable and can be used on newborns to adults. You can't hurt anybody with it, and it is amazing for anytime there's a fever or a respiratory infection, and honestly, most everything in between. I personally slather the feet with oils before I throw the ice cold socks and wool socks over them. And I've even done it during the day, not just at bedtime. So just know that once you understand how it works and the application of it, that you can utilize it in different ways and still find benefits from it, even if you're running around the house with a cold during the day. So anyway, I hope you have pen and paper. Without further ado, let's dive in. My intention in sharing this with you is so that you can avoid as many chemical prescription drugs, antibiotics as possible, because those things do further harm. They are very, very hard on the liver and kidneys. They wipe out the microbiome, and it's just a setup for recurring affections and future other illnesses and infections. So if possible, we want to avoid that. And also, disclaimer, before I get into this, this is not specific medical advice for anyone. Specifically, I am sharing with you what I do for my children and my patients, and things that are tried and true over the last 16, 17 years that do work. And if you try some of them and it's not working enough, you can always dose higher and get a little more aggressive if the virus or bacterial infection or whatever you're up against is a little more aggressive. So these are things that are very, very safe as long as you don't have an allergy to these specific herbs or oils or whatever it is we're talking about, okay? So just keep that in mind. Let's use common sense as you hear the wisdom that I'm going to share today. But the key is when a child gets sick, you need what you need and you need it right now. So it's best to be prepared if you want to treat things naturally or address things naturally. Otherwise, you're going to be tempted to succumb to fear or overwhelm or fatigue and reach for a quick fix, a drug, run to the ER, run to urgent care, or grab an antibiotic after poor advice. And most of the time, those things are not necessary. There is a time and a place, I acknowledge that, but most of the time, there is a better way. So anyway, first product. So this is from my Nature Sunshine store. I'm going to mention to you Oregon Grape. So this is a liquid herb. The active ingredient in this is liquid berberine. This can be used in a multitude of ways. So if my kids are sick and they are not an infant any longer, I almost always use Oregon Grape. So I am a more confident mother when it comes to dealing with the health concerns. I know I have areas that I can grow in and learn from other mothers in other areas, but because this is my career, I feel confident using some things that maybe other people won't. So always do things according to your own confidence level, or perhaps even schedule an appointment if you want to learn or get more personal applications for the things that I'm going to mention or that you might learn through this podcast or video. So Oregon Grape. This can be used for any cold or flu, so any bacterial infection, viral infection. So your child falls sick, runny nose, fever, cough, dry cough, wet cough, it does not matter. If you have evidence that there is an infection, that they are under the weather, even if you suspect it's just allergies, springtime or fall, hay fever, environmental allergies, Oregon Grape is a great option to use. So Oregon Grape will kill a multitude of infections. It has very strong antibiotic, antiviral, antifungal properties. It also can work against mold in conjunction with other biofilm disruptors, if that's applicable to somebody. It is also an amazing detoxer. So I personally use Oregon Grape in almost every patient or client under my care that is on the spectrum. So whether it's severe autism or more mild spectrum disorders, neurological sensitivities, inability to focus, ADD, ADHD, things like that, these are all general indications that there is a toxicity problem below the surface, whether in the gut or cells or wherever, that needs to be addressed. So you could use Oregon Grape for not just the 3 or 7 days that a child falls sick or 24 hours, but you could continue to use it to help pull some things out of the cells for 2 weeks or 4 weeks or 3 months even or longer. It is very safe. This is also great for an obese child, maybe a little bit older child who has blood sugar handling issues, has type 2 diabetes, is childhood obesity. Berberine is amazing for regulating the blood sugar, killing all those endotoxins, those infections in the gut, and helping to set them back on the right track. And if you're talking more of a detox application, stay tuned for more than a few minutes from now, but later on in this recording for the children's chewable probiotic that I'm going to mention, which also comes from Nature Sunshine, that's Probiotic Power. That could be combined with this for a great resource to start working on the gut at home and see how far you get as a mother, right? It's totally safe. So let's move on. So that's Oregon Grape. As a recap, any cold, flu, sinus infection, upper respiratory tract infection, any detox needs, vaccine injury, maybe jabs that you didn't want to get but did, this could be a great option to bring into the mix for a few months. It can all help detox from maybe unwanted medications if something happened and there was anesthesia or maybe some use of pain medications or something that you want to get out of your child. It would definitely be a wise option after an antibiotic, a chemical prescription antibiotic or steroid, for example, like with children with asthma, any GI problems, and all kids on the spectrum. Any digestive issues like gas, bloating, or stomach pains would also indicate a good indication for Oregon Grape. All right, next on our list is this product here called Seasonal Allergy. So Seasonal Allergy, people who I've known for quite some time may have known this product as liquid ALJ. It used to be called ALJ. Now they changed the name a few years ago to Seasonal Allergy and changed the label, but it is the exact same formulation. So again, you don't have to know necessarily the herbs that are in there and be an herbalist or specialist of any sort to know how to use this. This product, I want you to think of if there is mucus or phlegm for any reason, whether it's allergies or infection, but there is mucus, snot, sinus congestion, mucus in the lungs, a wet cough. So anywhere from lungs all the way up to the top of the head, sinus cavity, phlegm, you're thinking seasonal allergy or ALJ if you have some leftover from a long time ago that you may have had on hand. It's probably still not bad and it would be safe to use. But anyway, wet cough, runny nose, congestion, think seasonal allergy. You can take it as directed on the bottle. This again would be once you're past the infant stage, this could be applied. I personally would probably even feel confident using it in a still breastfed baby before they're on foods like at that young of an age. If you have a child though that has a lot of reactions, a lot of severe things, tread lightly. We usually don't dive in with herbs in those first few months of life or even the first year if you're not confident and you are noticing that your baby is reacting to everything. However, toddlers and above, 18 months and above, you've already introduced a multitude of foods. You can see that things seem a-okay, but they may have other symptoms. Seasonal allergy is a really good option. So again, phlegm for any reason, allergies or an infection like an acute cold or something, this is an amazing option. If you use a really low dose, like a quarter teaspoon at a time, and you find that it seems to be helping but not quite enough, bump it up to a half teaspoon and use it as needed. So give a dose. If symptoms seem to subside for 3 or 6 hours, but then they start to come back, just use it as needed to dry up the phlegm until the phlegm is gone. But do not use this beyond the length of the phlegm production because it is a drying formula and could make you feel almost like if you took too much cold medicine, you have dry eyes, dry mouth, just extra thirsty, which can just be annoying. So that's that. Okay, next. This is one of my favorite products of all time. So this is Silver Shield. This is safe for newborns to elderly and everybody in between. Silver Shield is not going to be contraindicated in anyone for any reason. The only thing that it is contraindicated with is salt or a strong binder like fulvic acid or zeolites or activated charcoal, bentonite clay, something that's binding and pulling things out of the system, and especially that can bind minerals. So because it does have microscopic pure elemental silver in it, you just would want to use it at least 2 hours, if not 4 hours away from any binders, or at least a half an hour away from salt. So salt will deactivate it. It won't hurt anybody or anything. You just waste your money. So just keep that in mind when you're using it. So this, I showed you, for those who can see this on video, I showed the 32 ounce. This is the best bang for your buck option. This will never go to waste. It has so many uses. So I'm going to get into all of what those can be. My family uses silver all the time. So we end up buying this big bottle, I don't know, like once or twice a year, depending on the amount of sickness that goes through our house and who needs it. But this product, this is 20 parts per million. So a lot of people are familiar with Sovereign Silver or other brands. But what I want you to consider when you're price comparing and also thinking about potency and dosing is what's sold in most stores is 10 parts per million. It is half the strength of this. And so while it may seem to cost less, you are often getting a weaker product and not actually saving money when you compare apples to apples. So that's one thing to keep in mind. And number two, this is SOL, Soul Technology, which means that no one can overdose on this or hurt themselves with it. It is different than colloidal silver. The microscopic elements in it are monoparticle size solutions, so it's much higher technology. They are very small. They cannot build up in the cells or the body like apparently the risk of colloidal silver is, or can tag along with it. So just something to keep in mind, but because you're paying for higher technology, that's the difference in price between colloidal silver or something like Silver Shield. This is a patented product, 100% safe for even a brand new newborn baby that might be sick with anything for any reason, or even have severe bloating or colic. This could be a great option to start with a really low, like 1/4 teaspoon dose, and start killing off infection in that baby. So Silver Shield and Silver Shield Rescue Gel. This is the topical application product version of it. So this is great for when you have infections or injuries, burns, cuts, surgical wounds, cold sores, anything of the sort that you want it to stay on your skin, pimples, whatever. Something also to keep in mind with the Rescue Gel, and then I'm going to circle back to the liquid silver and tell you how to use it, is the Rescue Gel. You'll see that there is a purifying gel and a Rescue Gel. The Rescue Gel is simply stronger, has higher parts per million. That's the only one I buy. I don't even waste my time with the weaker one. You are not going to hurt anyone with this stuff. This stuff can also be used for like vaginal infections and things that pertain to moms and women, just as an FYI. So this also will never go to waste, and it's great to have on hand. This replaces all of my Neosporin or triple antibiotic ointment and stuff like that. So Silver Shield liquid. So this can be used orally. So for any oral infection, oral pain, hint of an abscess, or post-surgery, you get your wisdom teeth removed, you have a tooth pulled, you have some irritation on a gum, you have a strep throat, anything that goes on in the mouth, you're going to take a mouthful. For adults, I would say take a mouthful, gargle it as long as you can handle, like 30 seconds, swish it all around as gentle as you can, and then swallow it. Don't spit it out. Then you're going to be taking an oral antibiotic and then getting in your systemic antibiotic. For kids, you just want enough that they can swish. If they're the age that they are old enough to comprehend swishing and gargling, you need just enough in their mouth, maybe a teaspoon, that they could actually gargle and swish. If you're dealing with cavities, again, strep throat, something going on in the mouth, or you're noticing that they have excessive amounts of cavities, you're probably up against bacterial infections, mineral deficiencies, maybe low stomach acid. That might be another podcast. So I'd love to hear from you guys if you have other ideas. But suffice it to say, Silver Shield is a great option when it comes to oral and dental health as it relates to anything infection related or surgery, prevention of infections. It can also be used in the ears or the eyes. So pink eye, you're going to get 1 to 2 drops in the eyes. It's 100% safe. I've seen this used effectively and help the body overcome pink eye relatively quickly, many times, in babies to adults. Also, ear infections is my #1 remedy. So for ear infections, you're going to drop 1 to 2 drops in the ear, 1 to 4 times a day, whatever is needed. If it resolves it in one shot, you're done. If you notice that the pain or infection blockage starts to come back, you're just going to do another dose. You are not going to hurt anybody putting this in the ears or the eyes. So it can also be nebulized, and this was a key product for me when my daughter had RSV. I was nebulizing silver with the pediatric mouthpiece, and right here I have a nebulizer that I got once I had kids that I keep in my house. I got this for $60 on Amazon. So what you need to know about a nebulizer, which I think is really wise to have around even if you don't have kids or anyone in your home with asthma, is nebulizing different things. You can nebulize more than just silver as well, is very wise when you have a severe respiratory infection or really bad allergies. If anybody has like constructive airway issues like asthma, constrictive airway issues like asthma, like wheezing, even if it's not full-blown asthma, or COPD, or is just really prone to nasty respiratory infections that like to set in and not go away, and persistent chronic coughs. So you're just going to fill the little medicine cup, which is approximately a teaspoon. You can do more all the way up to a tablespoon, it's just going to take, you're going to be sitting on the nebulizer a lot longer. Usually it doesn't take that much. But for a child, a half teaspoon to a teaspoon is more than enough for a breathing treatment when they have a respiratory infection. If it's an adult, you could either do it more frequently or you can do more Silver Shield in the medicine cup. Again, you're not going to hurt anybody with it. Really, about a 5-minute treatment when it comes to a little child is usually plenty to get that silver into the airways, which then goes immediately into the bloodstream. So something to know is outside of intravenous administration of drugs or whatever it is we're talking about, the next fastest route into the system, into the blood, is by way of the lungs. So nebulizing silver actually is a systemic application, and it is amazing. So I would try Silver Shield by itself first. Now, let me see if I'm forgetting anything. I've got my list here in front of me. Silver Shield first. So if it's an infection or if it's an asthma attack or a slight airway constriction coming on, start with just the silver and just test the water. See if this is nothing short of miraculous for you or you really don't notice anything. Then we can ramp up this application with this product. So this is good to have on hand for those who have any sort of airway constriction problems that need bronchodilation. So this product right here is called Lobelia Essence. Lobelia Essence is a liquid lobelia. I'll show it again. And lobelia is God's natural bronchodilator. It's amazing. So the herb lobelia, this is in liquid form. It is in an alcohol base because it has to be preserved when you have things in liquid form. You're not going to use too much of it. So for a child, I would start with 5 drops, a young child. An older child, if you're getting up to like age 6 or 7, it's pretty significant asthma or older, I would probably feel confident using 10 drops. So you're going to use somewhere between 5 and 15 drops. Usually this can be added to the Silver Shield in the nebulizer medicine cup, measuring cup thing. And this will add a powerful added layer of bronchodilation to your breathing, aka treatment, if you will. So these would be options to try so that you could try to use less steroid medication, which is what's commonly given for nebulizer treatment. Sometimes those are necessary. Do not fart around if you can't breathe or if it is an emergency situation. But this is something to try. If you catch it soon enough and you have the right things on hand, I have seen amazing results from people having these on hand and using this. You don't even have to, if you deal with chronic upper respiratory tract infections or chronic asthma, frequent asthma attacks, you can do this daily for a few weeks to a month or two, just to start to condition the lungs, kill off yeast and bacterial overgrowth in the lungs, start to open the airways and exercise them and get that bronchodilation going in more frequently, or just the silver for that medicinal value. And I just let it be known, this isn't the only thing necessary, but I have seen people completely overcome asthma. That is not unheard of. So don't let somebody tell you that it cannot, that it has to be a chronic life sentence to have asthma. There's deeper things causing this. Detoxification from vaccines or other antibiotics and systemic yeast or yeast infections in the gut and other things are also probably part of it. Low stomach acid, coming off of dairy can be a key lifestyle change for those who struggle with upper respiratory tract infections or asthma. So keep that in mind also. That would be a discipline that might be worth taking to see if it improves asthmatic frequency or intensity. Okay. And the seasonal allergy that I mentioned before this, for the mucus and phlegm and all those things, can be paired with nebulized silver and or lobelia to help overcome, calm down, or decrease the frequency and intensity of chronic asthma as well. So Let's see. Next, something else that you can add to a nebulizer protocol would be Silver Shield plus 1 drop of frankincense. So any trustworthy, pure frankincense essential oil. So I use the one from Nature Sunshine, always have this on hand. This has universal applications. So I'm going to get into other applications for frankincense. But 1 drop added to the Silver Shield in the medicine cup will pack a lot of punch when it comes to respiratory tract infections. So somebody has uh, COVID or bronchitis or pneumonia or anything going on with the lungs, severe allergies, adding frankincense to the silver, or even frankincense and lobelia essence to the Silver Shield to be nebulized is a force to be reckoned with. And it's not such a hot or minty oil like peppermint would be, to where it takes your breath away and makes you cough more. So you have to be aware of that if you're going to get experimental. I'm not going to advise those other things on this recording today. So while we're talking about frankincense, a lot of people don't know that even that have accounts with me through my online Nature Sunshine store, is they have amazing essential oils. This frankincense is organic, and so it can be applied a drop on the tongue in older kids or adults for any infection or cold, flu, whatever, and taken orally. You can also use a drop on the top of the head on as young as an infant that just comes out of the womb. So a lot of times I personally, I won't say we, I did this with both of my girls, put a drop of frankincense on their head as soon as they came out of my body. um, and you can go on a research trail about that, but it's very good for them and it's not going to hurt them, but it can be used for fevers or colds, flus, whatever application. You could also just put it on their spine. It can be used topically around the ear, so not in, but around the entire ear. So rubbed behind the ear, right here in front of the ear, kind of on the side of the cheek for an ear infection. So if you have a really stubborn ear infection or you don't have the Silver Shield on hand, you're now thinking essential oils. Frankincense would be a great one. It's a pricier oil, so I tend to go toward other oils if it's like ear infection related, or I'm advising another mother, client, or patient what they can do for their child. Or uh, actually, in the last 3 years, I've seen a lot of adult ear infections going around. So anyway, frankincense is one of many that you can use around the ear. If you're talking babies to younger children, then you're going to want to dilute the essential oils so that there's no chance that they're too hot, too strong. And again, rub it all around the outside of the ear. And a lot of times that alone is enough to knock out any ear infection. I just had this happen in November with my oldest daughter, who's 5. And she woke up screaming in the middle of the night, had no symptoms the day before, with excruciating ear pain. It's only the second ear infection she's ever had. And both of her ear infections when she was 2 years old was her first one. I put 1 dose, which was like 2 drops of Silver Shield in her ear, and that cleared that one up. And then here we are, almost 6 years old, her second one. I again put Silver Shield in her ear. 1 time is all it took, and I rubbed oils around her ear, and she calmed down in about 15 minutes. She went to bed and she had no trace of an ear infection after that. So pretty amazing stuff. I just hit it both ways with the silver in the ear and the essential oils around it to make sure that I'm just zapping it hard the first time. And I may or may not have to do even a second or a third application. And I see that often. So antibiotics, one of the #1 reasons why most kids get their first antibiotic in life is from an ear infection before 3 months old, but especially if not then, before 2 years old. And once you use an antibiotic, it is a setup for recurrent sinus infections or ear infections and other infections, because you wipe out the good bacteria. Their gut is still trying to develop. Most kids are born with dysbiosis, we'll say, an imbalanced microbiome anyway, because whatever was going on in mom's womb in microbiome is passed on to baby. And most people in general just are not well anymore. So we're already working with disruption and dysbiosis, and then you add an antibiotic to that in a developing gut, and it literally can wreak havoc on their health for the rest of their life until that balance is attempted to be reestablished by using like Silver Shield after an antibiotic to help rebalance the gut and kill the overgrowth of the bad guys that come after an antibiotic always and inevitably. So if we can avoid that, and there are other options to try first, why wouldn't we, right? First, do no harm, amen? Okay, I think I covered all my bases for frankincense. Let me make a few other mentions about using frankincense essential oil. So frankincense essential oil is another one that's like, if in doubt, use frankincense. So if you have anything skin like eczema or rashes or hives going on, using some just pure olive oil or castor oil or raw coconut oil with a little bit of frankincense in it, even in the youngest of babies, and applying it to the eczema can sometimes be nothing short of miraculous. If you try these things that I'm recommending and it's not working, those are your indications that it's perhaps time to schedule an appointment, recruit, find a good reputable doctor. I work with people all over the country. I'm 100% telemedicine now, so I am accessible. Or if you have somebody local that you already love and work with, it's time for an appointment if you're trying everything and you're not getting better. It just means there's something deeper that's you need to call in the experts on. So, another thing about frankincense, it's antibiotic, antiviral, antifungal. It packs a ton of punch. So no matter what you're up against as far as infection, it's a good option. Again, it's expensive, but it works and it will help tackle most types of infections, or at least be a good part of your arsenal to always have on hand. So that's another one I always have on hand for a lot of different things. It can also be applied orally, neat on the gums to try when babies are cutting teeth. However, my number one essential oil for teeth cutting, everybody listen up, is copaiba. Copaiba essential oil applied neat to the gums when teething has been my most effective recommendation for my own girls and for my pediatric clients and patients over the years. Nature Sunshine does not carry copaiba, but Young Living does. And again, the Young Living link is on my website, drjana.com. You can go down to the store tab and access it there. And I'm going to talk about a few of my favorite Young Living essential oils that I can't get through Nature Sunshine here in a few minutes. Let's see. Okay, so next, I'm going to circle back to essential oils. Let me mention two other things so I can move away from just the Nature Sunshine line as a whole. So this product and this product are worth a mention. I mentioned this earlier. They're Children's Probiotic Power, again, from my Nature Sunshine line. Chewable probiotic. I have both my 2-year-old and 5-year-old on this. They both take one with breakfast, one with dinner. If your child has any digestive symptoms, bloating, constipation, they're really gassy, they have stinky farts, they have eczema, they are getting sick a lot, often, too frequently, blah, 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 start on, once they're at chewing age and have teeth, so 18 months and up, 2 years is about the earliest you can start using this product. But it is amazing. It's got 11 strains of the most relevant infant probiotic strains in it, and it's chewable and it tastes really good. So I've never had a problem with getting a child to take this one. I would start with one a day. If you aren't getting enough results, if you have, for example, a kid with diarrhea or with significant constipation, then let's start with diarrhea. Definitely start slow. If you see it improving, but it's not quite enough, then you're going to add one with breakfast, one with dinner, or one with breakfast, lunch, and dinner. Just work your way up slowly if in doubt. And same with constipation. Almost all constipation is involving bacterial and yeast overgrowth, liver toxicity. So probiotics are always going to be a piece of the puzzle in any childhood or otherwise, even with adults, but not this product, constipation. So constipation in a child, even a 2-year-old and up, they might need one a day or one with breakfast and dinner, or they might need as many as 2 with breakfast, lunch, and dinner. And you're just going to follow their symptoms. So if you get to 2 a day and all is well, they're flowing better. You get to 3 a day and you see loose stools or the stools are getting too soft, you know that that's too much. So back down by 1. Go back to 2 a day instead of 3 a day. And in the future, if you ever see that happening once you're on a probiotic, and this applies to all ages, so if you're supplementing a probiotic and let's say you're taking a double dose of whatever is recommended on that bottle, and it was great for a time, and then you start to get looser and looser stools or softer diarrhea, back it down to the next lowest dose and see if your bowel movements solidify. And if so, it's just that it's working and you are getting a buildup of enough of the good bacterial strains in your gut, and it's now time to use less, which is a good thing, and that's what you want to happen. So it's a good rule of thumb for probiotics. The last one from Nature's Sunshine, I believe, is my children's enzyme product. So children's whole food papayazyme. So this does not have any hydrochloric acid in it. It's all enzymes and then a whole food blend. So it's kind of like a combination of a kid's enzyme that's more potent than most and Juice Plus all put together. So it has a long list, and so do the probiotics. Mangosteen fruit, broccoli flower, spinach leaves, asparagus, carrot root, tomato fruit, acai fruit, and pomegranate fruit extract. So you're getting a lot of micronutrients that aren't listed on the label just because you're taking a combination of freeze-dried whole foods with your enzyme, and that's going to provide extra enzymes and minerals as well. So with this, both of my girls also just take one with breakfast and one with dinner. But if there's constipation or worse, gas, bloating, more severe symptoms, you can always do one with breakfast, lunch, and dinner, or as many as 2 with breakfast, lunch, and dinner. If you get higher than that they're needing more than 2 per meal, it's time to move into probably an adult product that you need to mix into something else. And I would be scheduling an appointment with somebody at that point. Okay. Back to essential oils. So I already mentioned frankincense. That can be, I have that through, most people have heard of this, but I have that through my Nature Sunshine account and also through Young Living, of course. A combination that I have loved since my kids were born is I make this. So from Nature Sunshine, they have these glass roller bottles that you can make your own roller combinations. So I need a glass roller bottle like such, a bottle of carrier oil, right here, has a bunch of amazing, just gentle oils in it to use as a carrier, and it's not sticky or too heavy. And then Roman chamomile and lavender. So this is a blend that I made. I feel like the Lord gave me this wisdom, and I put about 5 drops of each in of lavender and Roman chamomile, both of which I get through Nature Sunshine. So this entire roller bottle could be made through your online Nature Sunshine account. Fill it to the top with carrier oil and put a label on it, however you want to. I use this still to this day, even in my 5-year-old. This is one of the things that I used on her spine and around her ear when she had an ear infection. But I love the spine over feet, especially for young children who touch their feet or are teething babies, or they're ripping their socks off, and I don't want sticky oils getting on my carpet or all over the house because it drives me crazy. So I pretty much use the spine almost exclusively to apply my oils. It's just personal preference for me as a mother. But having this roller bottle of lavender and Roman chamomile, when a child is fussy, colicky, has a fever, is just irritated, can't sleep, colds and flus, it is such a universal application that is amazing and safe. Those oils are safe for newborns and up. And as your kids get older and you don't have anybody left in the newborn or infant stage, you can make it more potent. So then I'm putting like 10 drops of each in there, yes, so that I don't have to use so much. And I'm not afraid of oil. So I've just found that most of the colds and flus, if it's enough to take them down to where I'm actually going to use something and intervene, then I'm going to want a little stronger application. But you do what you're comfortable with and the dilutions that you have been taught. But all I'm saying is carrier oil with Roman chamomile and lavender is a force to be reckoned with and is very universal. And I love it for fevers. For fevers, that combined with homeopathic belladonna, for me as a mother, has been a really great combination. When it happens, to like comfort the child, get them to go back to sleep, calm their little bodies, and also help fight infections. So keep in mind, once again, that Roman chamomile and lavender are both amazing antibiotics, antivirals. So you don't have to know what it is. You don't have to rack your brain on whether it's viral or bacterial and what you're up against. These universal application natural medicines, they can be used for a multitude of applications, infections, or just the things that we're up against, growing pains, whatever, with kids of all ages. So I still keep that on hand at my kids' age and have found it very helpful, and do use that more often than the other ones. So this is what Roman chamomile looks like. I'll just show it because I have it on hand. That's my little Nature Sunshine one. I don't have lavender on hand currently. That one can come from Nature Sunshine or Young Living. And then everything else I was going to mention are Young Living essential oils. I want to mention this line, and a lot of listeners are probably familiar, especially as mothers, because they have already mixed kids blends. So they have an infant, like baby line called, oops, that's not it, Seedlings. And they just have one, Seedlings Calm. And yes, while it is a calming formula that's already pre-made for you, so this could replace the one I just mentioned, the Roman chamomile and lavender, or you could skip that and get the pre-built one. It's very calming. So it can be used for teething. It can be used for sleeplessness. It can be used for colicky babies, many applications. You're not going to hurt them, but this is kind of your one size fits all baby formula. Then when they get to be like 2 and older, they have a line called KidScents. And the KidScents line come in already made rollers that are really pleasant on the eyes and easy to use with a really good roller on the top. Or they come in this size. I have the little kit of all the KidScents, and you can buy a bag of roller tops to put on the little bottles. So either way, but I wanted to mention these because the two that I use the most are the Snifflease, the blue one, for any cold or flu or sickness, Snifflease on the spine. I keep this in my backpack for kids. And then Sleepyze, they're calm, they're crabby, they're being kids. You need to calm them down. Sleepyze is amazing. And then my one that I've used sometimes, but my kids just haven't really needed this. It hasn't been super applicable in my home, but I have a few times, is TummyGize. So this is for any tummy ache, if you get the pukes or anything like that, but also just like indigestion after a bunch of junk food, kids' birthday party. Your kids do tend to have allergies, bloating, gas. This is great rubbed around the belly button. So just circle the belly button a few times, and it packs a lot of punch. So if your kids do have a lot of digestive problems, that's good to keep in your purse or diaper bag, backpack, whatever you have. So that's that. The KidScents line is awesome, and I do highly recommend it. It is super reputable, and it's easy, ready to go. So great for working moms if you're just not up for making your own roller bottles or do-it-yourself type of person. That's okay. And then I think this is the last one on my list that I'm going to mention today from these two lines, and I'm going to give you a few extra tips at the end. But this, if you're not familiar with flower remedies are amazing. So this remedy, this is from my Nature Sunshine line. So I'm sorry, I got a little bit out of order. I forgot. So this is called Distress Remedy. These are similar. Some people have heard of like the Bach flower remedies. The, what is theirs called? I'm so used to mine, the Distress Remedy, but this bottle is, I don't even know, like 6 times the size of Rescue Remedy. That's what it is. This would replace that, and it tastes sweet. So these are glycerin based. They're safe for all ages. They are flower extracts that pack a lot of punch for any type of emotional stress or distress. So whether a child has encountered trauma, they're just kind of hyperactive and you need to calm them down. you're in a season of high stress with school, or maybe a divorce, or whatever, trials of life, whatever that might look like, Distress Remedy is a great formula to have on hand that has a universal application that will basically diffuse stress, trauma, whatever, but it doesn't, it's not medication, so don't mistake how it works. It's very powerful, works amazingly well. I use this, I keep it on hand for myself more than my kids. If I feel really overwhelmed, I'm just in a hard season. I feel like my mind is racing. I've got a lot on my plate. It's hard to fall asleep. This is a great time to take like a dropper full before bed, or I've just been through some hard seasons in life. So it has been a lifesaver for me. It doesn't just calm you down, like take your nerves and deflate everything. It actually helps you to process emotion. And it's awesome because only God's medicines can do that. So it's not putting a band-aid on anything. It's not just like calming your nerves or a natural sedative or anything like that. It actually literally helps your body to assimilate emotion, trauma, stress. So when I went through and got diagnosed with PTSD 2 years after my first daughter's birth, and it just really took a toll on my life and my health, and it's a long story, but Distress Remedy was a key piece of the puzzle in me getting through that and processing the emotion and closing that chapter of my life. So at my second daughter's birth, which was a home birth VBAC after a very traumatic C-section and a lot of trauma to follow, um, my body expressed a lot of emotion right after I gave birth to her. And I kind of went into almost like a shock, but it was like a bliss. And it was a very weird experience, a new experience for me. I was taking Distress Remedy once every 15 minutes for about 2 hours. And my body was able to process all this emotion that was stored up inside of me that I feel like God allowed me to go through a redeeming birth. And it brought a lot of stuff to the surface, and it was just time to be released, and it all was coming out at once, which was a good thing. But this was a lifesaver for me in processing that and being able to breathe and enjoy the moment and enjoy that newborn stage like I didn't get to in my first birth. So that's an example that you could glean wisdom from and learn other applications that might be relevant to your family. But likewise, in a child who has emotional dysregulation, gets really heightened emotions, has big emotions, tantrums, anything like that, Distress Remedy could be very helpful for your family or social settings or whatever that might look like. Social anxiety, this might be very helpful for you. So just pray about it, but you can't hurt anybody with it. It is very safe, but also a very effective natural remedy that a lot of people don't know about. So that's Distress Remedy. Okay, so the other two products I wanted to mention are from a third line. Maybe you've heard this in commercials in some of my other podcasts, but the Cosiva line, if you go back to drjana.com to the store tab, you will see a company called Cosiva. They have two products that I am a huge fan of that have literally changed my life, that I have my entire family on. Advanced TRS and advanced fulvic. The combination of these two things are safe. Both products can be used in babies and beyond, in pregnancy and postpartum. So I love them for that application because I work with a lot of women in all stages of life. I work with children. I use these on my own family, and they have proven themselves to be literally life-changing. So if you are looking for and can't afford healthcare, but you know that your family, someone in your family or your baby or children need to detox, perhaps from medications or something that went into your body, or you had an epidural during your birth, or and if you had a C-section, then you were given prophylactic antibiotics, perhaps pain medications, whatever. All those things are passed on to babies. So I'm always looking for something that can be used in newborn or infant applications as well as adults, because there's not that many things that you can give them safely other than homeopathics and some essential oils. But finding things that are effective for really potent detox, these are my two favorites. So advanced TRS, it tastes like water. You just spray it in the mouth, and suffice it to say that these two products, the advanced TRS and advanced fulvic are a force to be reckoned with in detoxing children. So if in doubt, you just use the smallest amount, even one spray a day to start off, and you can always work your way up. And in more serious cases of like spectrum disorders, autism, severe allergies, anaphylaxis, chronic sinus infections or gut problems, you're going to want to use the recommended amount or more. So for me, I have used up to 30 sprays a day. I've been using 20 to 30 sprays a day regularly for a long time. I vacillate right now between 15 and 20 sprays a day. I've even gone when I've had a gluten exposure, I've used as high as 70 sprays a day and pulled myself out of it in a matter of days where it used to take me 4 or more weeks to feel better. So this stuff has been nothing short of amazing for me. But it's also a very good option for children. So there's a lot more information on my website and a little, what do you call it, pop out that will say COSIVA testimonials or advanced TRS testimonials. And there are pages and pages and pages of testimonials for how this stuff can be used and the things that it has proven faithful in, the things that it has transformed. So if this is piquing interest in you, or you have a child that has just a lot of chronic issues, or can't focus, can't think, is neurologically sensitive, it has amalgam fillings in their mouth, has had some vaccine reactions or otherwise, I would highly, highly, highly recommend you praying about advanced TRS at minimum or the combination of the two, because they will not return void and they can do so much for the human body so safely. They're not going to hurt anyone. And you can be very customized in how you dose those two products. So I think that's all I'm going to say about them. Just know that they're there. They are an option. And they are a gift from God as far as I'm concerned. With my own family personally, I did get off of all thyroid supplements, which I was on for over 15 years as a result of using these products. This may not be a great thing, but I could not tolerate coffee my whole life. And I started with the advanced fulvic and before TRS actually. And after using advanced fulvic for, I think it was about a month, I tried coffee. I would just have it every once in a while, and I didn't react. I didn't feel anxious. I didn't lose sleep that night. I wasn't sweating and jittery and like just feeling super anxious and keyed up. And ever since then, I have been able to tolerate caffeine and coffee since I started taking advanced fulvic, which I never expected. I had no intentions of that, but that was nothing short of miraculous, because for over 40 years, I could not tolerate coffee. So the benefits are far and wide of what this can do. And if it can do that for me, think of what it can do for a young baby, young children, and everybody in between. Last, I want to point you to some other resources on my website. So on drjana.com, I have a wellness blog. And on there, you can use the search box on any page on my website to see if I have something you're looking for. But one of my most popular recipes on my website, so I believe it's actually on my recipe blog, not my wellness blog, I apologize, is for Detox Lemonade. This recipe can be diluted down for young children, or my daughter's age 5, 6. They love this stuff. This is what they know as lemonade, but it's made with apple cider vinegar. And then you can add like lemon flavored collagen powder and add some protein to it, some gut healing protein powder. You can sweeten it with maple syrup or raw honey and make it healthier. But getting apple cider vinegar in your kids anytime they're sick, if they have gut problems, if they have allergies, if they have constipation, I feel like this is a must know for every mother for her family. So that recipe can be found at drjana.com on my recipe blog. And then on my wellness blog, I have a blog called List of Natural Antibiotics. That would be another great resource that you could print off and just have a resource of a long list of natural antibiotics and arsenal that you can use on your entire family. And just keep in mind that almost every single one of those, if not all of them, are also going to be antivirals, right? Antifungals, because in the world of natural medicine, almost every natural antibiotic is going to have some sort of other antimicrobial property and can be effective, or at least partly effective, against other types of infections. So some are better than others in targeting different types of infections. Yes, that is true, but that is a very good resource and starter, or just thing to have on hand to add to your medicine cabinet, just as a printout to have there. And I'm sure you can find a whole bunch of other things that are useful to you on that wellness blog. Then my recipe blog, all of those recipes are gluten-free. I think every single one of them, or 99% of them, they're grain-free. They are sugar-free, or have minimal glycemic index. They are all there for the person who's doing some version of a sugar fast, some version of a candida or bacterial overgrowth detox. So keep that in mind. There's keto, paleo, candida detox, sugar fasting recipes. All of those are great ideas so that you can have healthy desserts on hand and other ideas to get you thinking for dealing with chronic issues. If you have a lot of digestive issues, a lot of toxicity issues, then fasting from sugar for a time is going to be extremely wise in getting that under control. And when you're fighting any acute illness or even inflammation, cold, flu, whatever, pulling your kids off of sugars and all the carbs and processed foods is very wise, because all of those infections are fed by sugar and anything that breaks down into a sugar. So that's going to be the sugars as you know it, but it's also going to be like white potatoes, breads, crackers, chips, ice cream, all of those things that you may or may not think of as a sugar, like a comprehensive like sugar load or carbohydrate load. But we want to cut those carbs. We want to cut the processed foods so that the body can heal, and we're not fueling the enemy. We're not fueling the bad guys. We're arming the body with real whole foods that are medicinal to our body. So food can be medicine and is medicine if we make the right choices. So I'll leave you all with that today. I would love to hear from you guys. If you have a podcast idea or other questions that could be answered in a podcast, please feel free to reach out to my office at drjana.com. You can send a request through the Contact Us link or the web chat, and we will prayerfully consider any questions that could be answered on a podcast, or requests for topic ideas that you might have. So until then, stay tuned, and I'll see you next time.